Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, to wear or not to wear your face shield. The Interagency Task Force appeals to President Rodrigo Duterte to continue the mandatory face shield policy in several areas. The Health Department reports declining coronavirus cases in Metro Manila, but a doctors group insists severe cases are rising and hospitals are full. And later, will the DOH consider the proposal to shorten the mandatory quarantine for inbound travelers? Health Spokesperson and Undersecretary Rosario Vergeire joins us live. So the Interagency Task Force recommends to President Rodrigo Duterte not to drop the face shield policy in enclosed spaces and other high-risk areas. Malacanang and some senators confirmed that the president agrees on the proposal to only use face shields in hospitals. Manila Mayor Isko Moreno first proposed the idea, saying face shields are burdensome and costly to the public. Let's go straight to the source of the story. We have Health Spokesperson and Undersecretary Rosario Vergeire. Yusek, again, welcome to the source. Maraming salamat po sa inyong oras.
Magandang umaga po. Thank you po.
So, sabi na po ni Pangulo, ang sabi niya, face shields should only be used in hospitals, but the IATF is appealing this to the president to use face shields in enclosed areas. Just to set the record straight today, ano ho ba ang requirement o ang protocol with wearing face shields?
Well, Pinky, we have an existing joint memo circular, and this was based on evidences and science where we have required that face shields should be used inside enclosed spaces, especially in places of worship, workplaces, schools, establishments, and outdoors. You can remove your face shield if you're just alone, if you're doing this active transport like you're biking, you're doing strenuous work like you're in a construction company or this fine workmanship or you are a seamstress. But you need to wear it as soon as you finish your work or as soon as you are in a place where there are a lot of people. We need to get back to the objective of why we have mandated this face shield from the very start. This has proven to be effective because it covers your whole face, it covers your eyes, your nose, and your mouth, and it prevents the droplets from touching or landing on your face. That's why we saw that there is this benefit, and based on evidence, it adds more to the protection when coupled with the face mask and the physical distancing.
Okay. With regards to that, I know we've discussed this before. In fact, Yusek, I know you've had so many interviews, but I do remember the last time we talked, I asked you about this. Sabi mo nga, mas mabuti kasi alam naman natin kapag may face mask ka at face shield ka, medyo blurry yung vision mo, mas mahirap huminga. Ang sabi mo nga sa akin noon, mas mabuti ng magsakripisyo at mahirapang huminga kaysa mahirapan kang huminga dahil nagkasakit ka at you end up in the hospital. Pero yung iba ho kasi, nagtatanong Yusek, saan ho ba galing itong research o itong data na ito? Sino ho ba ang nag-aral at nagsabi na effective talaga ang face shields?
Pero naman po, no, yung mga eksperto natin, unang-una, nung last year, we had this two experts, si Dr. Tony Dance and Dr. Maya Herrera. They adapted a study done by Chung et al. Kung saan pinakita nito yung bawat intervention na non-pharmaceutical, hindi siya nagwo-work 100%. Pero pag pinagsama-sama mo siya, almost 99% protected ka from the infection. And the second one, meron naman lumabas after that, yung publication sa India wherein community health workers in one place in India used face shield when they went house to house, and none of these healthcare workers got infected when they had this kind of practice. Also, there were studies in Lancet And some of the other countries are using this, like Malta, even in the United States, in I think one state in Oregon State, and also in the United Kingdom. But in other countries, it was purely voluntary. It was not mandated.
So hindi po totoo yung sinasabi na tayo na lang ata sa buong mundo ang gumagamit ng face shields.
Hindi naman po, dahil dun sa experiences na meron tayo in publications na ginagamit naman, though it's voluntary. Although I always say nga na we do not need to compare with other countries actually. We just need to see the benefit that it is giving us, itong face shield na to. We've gone through a lot of increase in the number of cases, and this face shield starting June has helped us. So ngayon tumataas po yung mga kaso sa iba't ibang lugar sa bansa. I don't think it would be so much for our citizens to just wear these face shields in an appropriate setting.
Would you submit though, Yusek, that if masks were if we wear our masks properly, that face shields aren't necessary? Or would you still say na kahit po tama ang suot natin ng mask, kailangan pa rin po ang face shield?
Yes, I can say that because of the evidence that we have, that even though you wear your face mask, it only gives you, based on studies, if you wear a facial mask, the surgical mask, it gives you about 67% protection. But if you couple it with the face shield, which gives you additional protection, it gives you around 90+% protection. So it means because the face mask covers your nose and your mouth, and the face shield will cover the whole of your face. And we know that when a droplet, if you interact with somebody who is positive and droplets land on your face, you may touch it, and then it can reach your mouth, your nose, and your eyes. And your eyes are also not covered by the face mask. So face shields would be very beneficial. It also has secondary effects because Filipinos would always tend to touch their face mask. Filipinos would tend to always just wear the face mask over their mouth. So when you have the face shields, you have added protection.
Parang kahit papano unconsciously napoprotektahan tayo, because often we see a number of people na yung mask ay nandito lang po sa bibig. Hindi ho ba? Hindi na halos natatakpan ng ilong.
That's right, Pinky. And also tayo unconsciously, most of the time, we will be touching our faces. And that's one of the modes of transmission. Pag hinawakan mo yan, nahawakan mo yung ilong mo, yung bibig mo, o yung mata mo, maaari ka ma-infection. But when you use your face shields, nawawala yung ganyang habit kasi. Dahil may naka-block dun sa face mo, hindi mo mahawakan yung mukha mo.
Paano po, let's say even in restaurants, pag upo po natin, tatanggalin natin yung face shield, tatanggalin natin yung mask, lalagay natin pwede po sa table, pwede din po sa bag. Hindi ho ba yun po ay posibleng maging cause din ng pagkahawa? Kasi we don't know how clean, well, number one, our belongings are, number two, the tables na pinagpapatungan natin. At saka yung isa pa po, Yusek, hindi naman daw kasi talagang nililinis itong mga face shield. What do you say to that?
Well, we have advice na nililinis po dapat ang face shield. Araw-araw yan. Pag ginamit po natin, kailangan nililinis po din natin yan ng disinfectant natin, tapos ibibilad natin sa araw, o di kaya you let it stay outside of your house para mahanginan. So kailangan pa rin pong nililinis, hindi pwedeng ginagamit na hindi natin nalinis for a day na ginamit natin. Secondly, for restaurants, it's included in our joint memo circular. Na nakalagay po dyan, when you go to a restaurant, it is expected really because you will eat. So you remove it. But as soon as you finish eating, you have to wear it again. So how do we now reconcile that, na sinasabi natin, tatanggalin natin, paano tayo maproteksyonan? Diyan papasok yung iba nating safeguards. As I've said, walang single intervention na non-pharmaceutical ang mag-work 100%. So all of these had to be taken together. So when you remove your face shield in a restaurant or your mask when you eat, nandyan yung safeguard natin ng adequate ventilation, physical distancing, and maybe engineering barriers dito sa mga restaurants na to that will work for us while we eat.
There's a comment here, but Undersecretary, there's also a study that COVID-19 cases ay airborne. I know, alam na po natin yan, hindi ba airborne na po yan. Face shields po ba ay effective din if airborne transmission?
Pinky, kailangan natin i-qualify yan para hindi maguluhan ng ating mga kababayan. Yun pong airborne na sinasabi, it happens in enclosed spaces. Ibig sabihin, kapag ikaw ay nasa kulong na lugar, mas nagsistay longer ang virus sa air. So it's just like that. Ito na po yung pinaglalaban natin ngayon, that dahil nga po meron ng ganitong pronouncement ang WHO that it can be airborne in enclosed spaces, all the more we need face shields in enclosed spaces because it adds to the protection. Just imagine if you interact with people in an enclosed space, tapos tumalsik po sa mukha nyo yung mga droplets na ito, magland sa face nyo, you don't have face shield, and then mas vulnerable ka dun sa infection. Kaya umaapila po kami ngayon na sana po kahit sa enclosed spaces ay magamit pa rin po natin itong face shields na to.
And Yusek, kayo po, sabi mo nga, ipaglalaban ho ninyo ito dahil para po sa inyo, sa inyong pag-aaral and research and studies, this is necessary.
Yes, Pinky, I told my sons nga last night, sabi ko, kung sakaling tatanggalin, tayo gagamitin pa rin natin. Kasi magiging voluntary naman yan, but I would like my family to be protected.
Okay, so Undersecretary Vergeire already mentioned there's this DOH circular on the mandatory use of face shields outside of residence. Ulitin ko lang po, Yusek, para po hindi malito ang tao dahil nga pag after the pronouncement of the president, some people may say, well, I just really need to use this in enclosed air, in hospitals. So the IATF is appealing this to the president. And in this circular, we're showing it on screen. Ito po yun, yung minention ni Yusek. Please add or please correct me if some of the siguro words are wrong or the areas are wrong. Enclosed public places, schools, workplaces, commercial establishments, yan po, public transport and terminals. Kailangan pa rin yan, places of worship. And this is important, public places where 1 meter distancing is not possible. Ibig po ba sabihin nito, pag nasa labas po tayo na public place, pero may 1 meter distance po tayo, pwede na po nating tanggalin si face shield?
Tama po yan. That's according to the Joint Memo Circular. Kaya nga sinasabi po namin, na yung outdoor places naman, pipili lang tayo ng setting kung kailan nyo kailangan gamitin ang face shield. Halimbawa po, nasa park kayo, tapos hindi naman po ganun kadami ang tao, tapos ay nakakapag 1 meter distance naman ng mga tao, hindi naman kailangan mag-face shield. Kasi balikan natin yung objective. Yung face shield po, poprotektahan kayo pag may kaharap kayo, di kaya magkakasama kayo, tapos meron hong droplet na mag-land sa face nyo. Pero pag magkakalayo, hindi naman kailangan. Ngunit ang inapila na nga lang po natin sa Office of the President, kahit yung indoor na lang, yun na lang po ang payagan. Dahil ito po talaga ay makakapagbigay pa rin ng additional protection sa ating mga kababayan.
And if the President allows this, I think one of the siguro adjustments that will be made is when we walk. Pag naglalakad po tayo, papunta tayo one place or another, pwede na po nating tanggalin ang face shield if the President allows only in enclosed areas.
Tama po yan, ma'am. So when you are outdoors, kung pumayag po ang ating presidente, hindi na po natin siya kailangang isuot. Magiging voluntary na lang po yan. Pero pag nasa indoors kayo, ito po ay imamandato natin kung papayag po ang ating presidente.
As a last question on this, what kind of siguro effect do you think, Yusek Vergeire, the wearing of face shields only in hospitals will have sa ating pong mga kaso?
Kung papayagan po at ang magiging mandato na lang ay sa ospital, sa tingin ko po mababawasan tayo ng isang armas sa paglaban sa COVID-19. Tandaan po natin na ang ospital po sometimes yung environment doon, it is an enclosed space, may also be mimicked in other enclosed spaces, especially in places of worship. Kung matatandaan po natin, yun pong mga surges of cases in other countries started in churches because in churches po talaga, super spreader events ang kinoconsider dahil everybody sings, nagsasalita ang mga tao, kapag sumasagot sa kanilang mga pagdadasal, and maramihan po na tao. So ito pong ating mga settings na to, kaya po natin napili because we know that the probability is very high for transmission. That's why the face shields can add more protection for our people. And hindi po natin pwedeng idiskwento yung mga porsyento na pwedeng idagdag nito sa ating protection, lalo-lalo nang tumataas po ang mga kaso.
We're going to talk about ICU cases dahil the numbers in NCR are supposed to be going down, but the Philippine College of Physicians is saying bumababa daw man yung numero. Dumadami naman daw yung critical cases, or we're seeing more severe cases in NCR. But we need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, health spokesperson Maria Rosario Vergeire. Yusek, what is happening in NCR? Is this something that your data supports? Because the Philippine College of Physicians is saying that, all right, the numbers are going down in NCR, pero yung pong critical cases or severe cases are actually going up. Again, let me ask, is this true? Do you support this finding? And if so, why is this happening?
Unang-una, pinag-aralan nga namin, binalikan namin agad nung narinig namin itong news na ito from Dr. Limpin. We understand their position dahil sila naman po yung nakakakita. So upon review, nakita natin na meron nga po tayong mga ospital na talagang almost full ang ICU. But upon further review, makikita natin itong mga ospital po na meron pong pagkapuno ay talagang maliliit lang po ang kanilang allocation for ICU beds. Some have 2 beds only, some have 3, some have 7 beds for ICU beds. So maliliit po, kaya madali po mapuno kung may mga pasyente. Hindi naman po natin sinabi na wala na tayong mga kaso dito sa NCR, pero pag tinignan kasi natin yung overall, it will not show. No? We are just seeing this in certain places. Though we cannot deny na meron ho tayong mga areas ngayon sa NCR na tumigil na po yung pagbaba ng kaso, nagpa-plateau po, at medyo fina-flag na po ng mga numbers natin na medyo may pagtaas na. So kailangan lang ho natin tuloy-tuloy tayong mag-manage nito so that we won't be able to have this increase in the number of cases again.
Yusek, which areas are these?
Well, we are seeing an increase in cases in some of the cities like Pasay, Malabon, and Parañaque. Pero syempre, pinag-aaralan pa natin yan. Hindi naman po siya nagiging stable na tuloy-tuloy na pagtaas. Pero nakakakita po kasi kami ng uptick. That's why we are closely monitoring. Also, in NCR, meron na rin po tayong tumataas na average daily attack rate among cities, about 11 of the cities out of the 17. And doon naman po sa ating ICU utilization, makikita natin meron tayong 3 cities na medyo mataas talaga. And nung tinignan naman natin, this is because ever since, ito po ang problema natin, yung number ng ICU beds na allocated. So what we are trying to say would be very fragile ang sitwasyon natin sa NCR. Kahit na nakita nating bumababa na nakapag-decongest tayo ng ospital, pero yung mga ibang mga lugar sa Pilipinas ay tumataas, ganun din po, no? Madali din po tayong pwedeng bumalik sa pagtaas kung hindi po natin mamamanage ng maayos.
I think the key word really is what you used, fragile, because at any given time, Yusek, pwede ho kasing tumaas yung kaso. In other words, kung tumaas man, mabilis ho kasing pwedeng tumaas yung mga kaso. A number of points that you raised. So you said 11 out of the 17 cities na notice nyo, tumaas po yung daily attack rate. Ano po? What would be the reason for this? Would you say it's opening up the economy? Would you say it could probably be a variant, one of the variants that is already present here in the country?
Yes, ma'am. No? So we're looking at the multitude of factors when we look at this increasing ADAR. even in other areas, actually, pare-pareho naman po ang factors natin. There's mobility, number one. Number two would be our compliance to the standards. Number three would be the response also of government. Nakikita ho kasi natin yung ating time from detection to isolation is still long. Matagal pa rin bago natin ma-isolate ang isang tao when we detect them as being positive. So yung length of time na naiiwan at hindi pa natin sila na-isolate causes that transmission, no, among people.
Yeah.
And then the most important thing that we consider right now would be the variants. Meron po tayong UK dito, meron tayong South African dito sa Metro Manila, and we know that it has increased transmissibility. Kaya kung sakasakali, sana po may ma-manage nga natin, we can all comply with the protocols.
And yung pong sinabi niyong puno na ICU because some of the hospitals have a very limited capacity, which areas are these rather?
Yes, ma'am. So ever since naman po in San Juan, because it's a small area rin naman. So ang San Juan naman and even cities in Metro Manila, we rely on our networks. No? So San Juan has a small area at maliit ang kapasidad pero nakakakuha siya ng tulong dun sa mga karatig niya ng mga cities when it comes to hospital facilities. Now we also have Makati kasi sa Makati po meron lang po dyan 3 major na ospital na nagagamit ang ating mga kababayan. And ever since naman yan pa rin po. And again, the network also helps them especially during times of increase in the number of cases. So ito pong dalawa na ito, ang Las Piñas po would be nearing this level na medyo at risk na rin po. And again, the capacity pa rin po ang ating tinitignan dito.
Ang sabi ho kasi ni Dr. Limpin, ICU beds are full in NCR. This needs to be discussed because obviously this is a big problem. And ang gusto ko po, ang sinasabi niyo po, hindi po totoo na all that ICU beds in NCR are full. This is not true. This is what you're saying, Yusek.
What I'm saying would be there are really hospitals in Metro Manila that are nearing that maximum capacity for ICU beds for COVID. Pero hindi po yan pangkalahatan, hindi po yan yung totality. Kasi ngayon, ang total natin sa ICU utilization would just be at 47%. So ibig sabihin po, yung mga ibang ospital dito na nakakaranas ng ganyan, nung tinignan po natin ng datos, ay maliliit lang po ang kapasidad nila for ICU. Although there is this one hospital na medyo malaki naman yung capacity niya, nasa mga 20 beds, pero hindi naman po ganun pa rin kapuno sa ngayon. Kaya nga po ang sinasabi natin, we need to expand our beds, especially in this smaller capacity facility, so that hindi po tayo magkakaroon ng overwhelming, pag ma-overwhelm tayo, pag dumating yung pagtaas ng kaso. We need to prepare for now.
Okay, we need to prepare already, right now. We need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Undersecretary Maria Rosario Vergeire. Yusek, okay, so we're clear on the face shields, especially the stand of the IATF here. Now, quarantine protocols, because you already have some senators really pushing for a more relaxed quarantine period or a shortened quarantine period. I just want to know, is the IATF or even the DOH looking into this? I know the argument, and I do understand why it was 7 and 10 days in a hotel plus 4 days at home dahil nga dun sa 7th day, doon posibleng lumabas yung pinakamataas na viral load indeed if somebody is positive. But with the recent data, do you think it's time to kind of shorten this quarantine period?
For us in DOH, we really do not see that it is appropriate at this time because of the increasing cases, because of the Indian variant actually. We are very, very cautious about the Indian variant that it will not enter our borders. So currently we have 13 cases of this and we were able to isolate them immediately because of our protocols. And hopefully we can continue to do so because we can see how it is ravaging the other countries. UK, with almost 50% of their population vaccinated, is having another surge because of this Indian variant. So at this time, I think even our experts are saying it will not be appropriate for us to have this short-term shortened quarantine period for our incoming travelers. Although it is being discussed right now in the IATF for those fully vaccinated returning Filipinos, if we can also have that same protocol with those Filipinos who had been vaccinated here in the country. That is what is being discussed right now in IATF.
And that is the 10+4. So here's a piece, siguro information coming from Reuters, Yusek. I'm not sure if you've read this. This only just also was passed on to me, to be quite honest. In Jakarta daw po, this story is from Indonesia. More than 350 doctors and medical workers caught COVID-19 in Indonesia despite being vaccinated with Sinovac, and dozens have actually been hospitalized. And then basically it says most of the workers were asymptomatic and self-isolated at home, but dozens were in hospitals with actually high fever. And they're saying that they are battling an outbreak believed to be driven by the more transmissible Delta variant. I bring this up because you had mentioned this. I think it is also Dr. Edsel Salvano who said that this is 60% more transmissible than the UK or the South African variant. How concerning is this piece of information that I just read and I read to you, Yusek?
Yes, actually, Pinky, real-world studies are coming out right now, and we can really see that the vaccines are effective. Although for this variant, the Indian variant, Sinovac has still not released their real-world study or their study on effectiveness against these variants. But having said that, looking at that article, we need to be very cautious kasi matatakot ang mga tao. Kasi po yung article na yan, hindi naman niya sinabi kung itong mga bakunadong ito ay fully vaccinated or just received one dose. And also, kailangan din po nating tignan yung number of those healthcare workers that they had. If they had about, for example, if they have 5,000 healthcare workers and the infections were just at 300, maliit po na porsyento yan at makikita natin na let's say that's 3%, 97% pa rin naging epektibo ang bakuna.
Yeah.
Kung halimbawa naman po dun sa mga na-ospital, kailangan pa rin po natin makita kung ilan po yung pinag-uumpisahan natin na numero ng healthcare workers. So bottom line would be, let us be cautious in interpreting these relative numbers because hindi po kumpleto yung article. Kailangan po namin pag-aralang maigi. But of course, the cautious, we need to be cautious also, no? Kaya nga po sinasabi natin, we are very much worried about this Indian variant because naapektuhan din po niya yung epekto ng bakuna at as to how much we still don't know. So everybody has to be careful and our border should be protected.
I guess at the end of the day, Yusek, whatever vaccine it is, the bottom line is we can still get infected. And the best thing really for us to do is to protect ourselves. Whatever sigurong bakuna yung nakuha natin, dahil nga siguro iba-iba na yung variants, hindi na po natin alam kung gaano katindi and how siguro how protected we are how much protected we are rather against these variants.
That's right, Pinky. So thank you for saying that because I want to emphasize really because there are a lot of people who thinks that vaccine is the only thing that we can do to fight off this pandemic. But no, kailangan po it is coupled with the minimum public health standards. It is coupled with border control. So ang bakuna po, ito po isusupplement niya itong mga ginagawa na natin dati pa. So we need to continue protecting ourselves, protecting our borders, and having this vaccine para po tayo ay magkaroon na po nitong pagbaba ng mga kaso.
Undersecretary Maria Rosario Vergeire, ma'am, as usual, maraming salamat po sa inyong oras.
Thank you very much.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.